As I said, we live in the Google era, and everything is digitalizing. And I think the future is in the education of the patient, but the doctors must serve. The doctors must go to the patient and inform them, and not the patient trying to find something in Google, which is sometimes controversial. And this is what we are not learning in the university, and this is what we have to establish. And as academicians, as academics in the universities, how to, in the modern society, how should we let the patient educated or informed? And of course we have to use these modern technologies as an internet and etc. We have virtual reality, or we already live in virtual reality and in augmented reality. And I think that the communication between doctor and patient will change, yeah? And it will change maybe in the next, not 10, 5 years. And it's changing now. Because you look to the robotic surgery, look to the robotics and computer technology in the medicine. It is rapidly development. It's unbelievable in the last 10 years. And this technology will come also in the field of communication. I don't know, because we don't know how the digital technology is going to develop in the next 5 years. It might be, but it will be rapidly, for sure. But how is in the end, we don't know. What is the new, well, the surgery is changed. Probably you would do all the surgery robotically or semi-automatically. And I believe sometime in the next future, probably the robots or semi-robots could treat patient and could do the surgery. I think it's a future. But we should, as a human, find our place in this future world. And we have to learn to live with that. And we can actively develop this. And this is a very important point. I think the future is to make our surgery better in terms of to improve the quality of life of the patient, of the couples, of male and female. And I think the important is to be open to new developments and try to implement these developments to make the life better. But why I have luck? I have a story for you, because I'm doing robotic surgery, and I did a surgery in 53-year-old male, and he was completely active in his life, sexually active. But unfortunately, I should remove both nerves because of Gleason 9 and did extended lymph node dissection robotically. But 1 year ago, he came back and said, "You destroyed me." I said, "Why? The PSA is now 0. It's okay. Oncologically, I saved his life." But he said, "No, you destroyed me. I'm impotent." And I said, "Okay, I can fix you, and I can just recommend to underwent him to the surgery." And I did the surgery, and 2 years later he came and said, "Okay, you saved my life, but I was unhappy, and you made me happy." And what we are doing as prosthetic urology, we made a human, a male and a female, happy with our surgery. And this is something unique, which is not, because I'm an oncological surgeon and even oncologist, but also prosthetic urologist. This feeling is something different. And this is the real quality of life, which we share.